Brenda here, and we're going to get started. Thank you all so much for being here. We're really excited to have you.
Welcome, welcome. We are so glad to have this time to talk with you about the progress of our work introducing digital mental health resources to schools. So today we thank the Upper Midwest Telehealth Resource Center for helping us with this work. We want to acknowledge some of supporting organizations of the work that we're doing. And I'm here with my colleague, Terry Murphy, who's a digital health expert. I am a school psychologist, clinical psychologist by training, and we're both happy to be here, and we'll introduce our spotlights as we go throughout the talk. The Partnership for Connected Illinois has been a leader in looking at the ways that telehealth can be used to support behavioral health needs across the state. Their sustaining partner, McDermott, Will, and Schulte, has been an important part of that. So for the last 5 years, Terry and I have been working on pilots. So we had a 3-year pilot project. Our goal was to raise awareness of digital mental health tools that were available to integrate with the existing school mental health resources, and then to understand what makes a successful implementation and put that together into a guide for other schools wanting to do the same thing. So this is a timeline. We started in December of 22, and think back to what was happening. That was very much still in the thick of the pandemic, but after the shutdown, when schools were having students and everybody was kind of getting back to being engaged in person. We set out to gather lay some groundwork and gather some information. So we spoke with schools and behavioral health providers all across the state about what was happening. Everybody knew that children's mental health was just really exploding. But what we understood as we talked to schools was that everybody who had any mental health training at all were working between 8 and 3 to try to help kids be able to be well enough to be in the classroom. And there were a lot of disruptive behaviors, a lot of crises going on. And so the school-based mental health providers were really just tapped to the max dealing with what was going on. And they had also brought in behavioral health providers from the community to try to help with these intense needs. And so what we learned was that we should be looking for digital mental health tools that could help with what we call the upstream needs. So those kinds of things that weren't really getting done during that period of time because everybody was dealing with crisis. So we piloted a tool at Glen Ellen School District and also in Distinctive Charter School Network here in Chicago. So that was a suburban and an urban implementation. Then the next year we implemented in down by Egyptian Public Health Department, which was a 5-county, extremely rural implementation, and Bourbonnais, which is considered ex-suburban, so it's not quite suburban, it's a smaller town. And then currently we're doing our 5th pilot in the Chicago Public Schools. And so we're going to be kind of tracing this work that we've done. And I want to invite you to be thinking about and contributing even to, like, what are the next steps beyond this 5 years of these, 3 years in these 5 pilots. So we had a number of grant funders that made this possible: the V&A Foundation, Sprague, Blue Cross Blue Shield, the Illinois Office of Broadband, the Stone Family Foundation, and Seyfarth Shaw. So today we're going to talk very briefly about the needs, because we all know what they are, but how those have evolved since the pandemic, what these resources are, these digital mental health tools, these 3 implementations that we're going to spotlight today that are all happening in Illinois right now, and then our current pilot at CPS and some lessons learned in this work so far, and we'll end with Q&A. So the first thing, there was a silver lining to the pandemic, and that was we recognized a lot of things. We recognized that we have to address mental health needs. If they go unaddressed, it's disastrous. There's a need and a benefit for broadband and digital access, and particularly equity in broadband and digital access. Schools are a major provider, a primary source of mental health services. There's a need for funding these healthcare services in schools, and most schools during that period attempted to hire or contract and built partnerships with their local behavioral health providers in their community. So between 22 and 24, as we were beginning to implement, what we found is that many young people were starting to rebound from the worst of that mental health crisis, but needs never dropped before the down to pre-pandemic levels. So there's lots of sadness, hopelessness, and suicide still during that period. Then we have what's going on, and beginning in 2025, what's going on with the mental health resources or the system that's meeting those mental health needs. So there were still ongoing workforce shortages, changes to access to higher education for providers, and now student loans are becoming very much in the news. And how that's impacting our overall system of mental health resources. There was this COVID funding cliff that hit where there was a lot of money in schools to pay for behavioral health, and that kind of went away. And then in the last year, there have been a lot of cuts and uncertainty, not only to education and mental health and substance abuse programs, but also research and things to fund things like what we are doing. So the state of mental health now in 2026, the adults are having a major preoccupation with economy and just basic needs, housing, food insecurity, things like that. And we're experiencing some increased barriers to accessing healthcare outside of the schools. So there's lots of uncertainty about Medicaid, people losing access to some of these mental health resources as a result of that, and then quite a bit of heightened distrust among vulnerable populations in particular. So that's what's going on for the adults. So imagine what's going on for the young people. So right now, areas that have worsened, even though we've rebounded from the pandemic, are anxiety and just a sense of chronic stress for young people that is way different than we measured and we understood it before. There's safety issues, physical and psychological safety, a lot going on around identity. As you all know, adolescence and junior high and high school is a huge time where people are figuring out who they are, and that has become really complicated for young people. And then social media, which is a complicating factor in many ways. So in schools, we use what's called a public health model, but in schools, we call it a multi-tiered system of support, or MTSS. And this is really important to the work that we've been doing. So when we were talking about how can we, through schools, be the tide that lifts all the boats, a public health model is our route to doing that. So tier one really refers to the whole triangle, and we're going to use those terms a lot throughout the webinar. Tier one is what we do for all the kids so that they grow up happy, healthy, and functioning members of society. In a sort of a classic public health model, 85% of our kids should grow up and do well based on what we're doing for everyone. About 15% or so may get off track. They may need something more than what we're doing for everyone. And then about 10% of them, we can expect even in good times to develop a disorder or something that needs actual like one-on-one therapy and treatment. And the schools really prioritize those three areas. And then we have a very small population of students that also are getting lots of resources and help from different organizations, and perhaps their whole family is getting help. So this is kind of a classic illustration of the public health model. And we're going to be focusing on tier one and tier two for the most part in this webinar because of what we learned from the schools when we talked to them. They said, we're focusing on tier three, these kids that are in crisis, have disorders, etc. We are not able to do this upstream stuff anymore. And so kids are deteriorating because they're not getting those supports that we used to offer in schools. So this was our rationale. to use this public health model and these upstream is that the prevention and health promotion is really the most cost-effective approach because you reduce the frequency and the intensity of disorders, and every child benefits when one child benefits in this type of design. So I'm going to hand it off to my colleague, Terry Murphy, to talk about the digital mental health resources that we found across the country. And with the focus on this tier one, two, and maybe early tier three focus to supplement what the on-ground people were doing in the schools.
Okay, thank you, Brenda, and hello, everyone. Great to be giving you this update. Just as a note, the prior webinars we gave, and we've done these roughly every year for the last 3 years, they're available on the PCI website, which Brenda or Nancy, could you post that in the chat so that people can find the prior ones? We have 3 guest participants today, each using a different tool. One's using a tier 1 and tier 2. It's kind of a combined tool. One is using a tier 2 and one is using a tier 3 tool. So we did want to highlight those. In prior years, we've had different guest experts that have also presented some of those. Whoops. Next slide. Just don't go that far. Yes, there we go. Perhaps you've seen some of this in the news. A couple of years ago, California made really big news because they approved a couple of resources for statewide use. And one of those is mentioned here in the middle. Actually, one of our schools today is using a tool, a resource that has also been approved for statewide use. You'll hear more about that. By the way, because we are a not-for-profit organization and we're objective, we don't have a relationship with any of these vendors that are providing these tools that Brenda's mentioned. We try not to mention these companies by name, at least ourselves, but certainly our guest experts are going to, or our guest presenters are going to share a little more specifically what they're using and how it's going. Next slide, please. This next slide is the one slide that this will really be our, at least I hope, I'll try not to slip, but this will be our only reference to this vast ecosystem. These are generally new companies, almost entirely, and you can understand why. The capability of digital and the kind of issues that Brenda has represented, and certainly COVID, a number of these companies came to the fore. Some of these are tier 1, some are tier 2, some are tier 3. As Brenda mentioned, we initially focused on the tier 1 and tier 2 resources for early intervention and upstream prevention, if you will. But today, one of our presenters is going to share about their tier 3, which is teletherapy. I will say, these, and there's 17 here. Actually, if you know of one that we might have missed, put it in the chat because we are always trying to keep up with companies that we haven't heard about. But here's these type of resources, these digital resources that are supplemental to the school's therapists and social workers generally share a couple of characteristics. One, they are immediately available. Secondly, they are less costly, significantly less costly. Third, they cover more kids and in some cases parents than the limited school one-on-one resources can. And they're extremely convenient. So all of that yields some pretty tremendous engagement. If you have to leave this session early, like at the 1 hour mark, you might want to check out the recording because in the last half hour, we're actually going to go through engagement statistics, which is key. You know, if you make an investment in something like this, you always want to know, are people going to use it? And our 3 guest presenters are going to share some of their tips and tricks for doing that, making people aware. But these are generally resources that have been quite popular, surprisingly so, and they break that barrier of stigma that get people using something at less risk, and you'll see more about that in a minute. Okay, next slide. So this was our process. Brenda alluded to this in our first year, and this goes back to 2022, I think it was, maybe 23. We first looked at that ecosystem of players. We tried to screen out who was pure teletherapy because we did want to focus on tier one and tier two, but also those resources that were not serving K-12 schools. Most of what you saw on that last slide are serving K-12 schools. And then we would compare these. We went through a fairly rigorous, and we try to maintain our information because these companies are adding new features and functionality and so forth, changing their business model in some cases. But we tried to compare, and we did side-by-side comparisons of these. And it's a fairly detailed one. Brenda and I are asked to come into school districts and share with them this ecosystem and do this comparison so they can figure out what's right for them. Again, we're objective, so we've come in and do that for schools, and then they pick what they think, but with a lot more information on what's available out there. The third phase, which really got to our 3 years ago, we got our first grants to do pilots, and so that was an opportunity to really work with schools in implementing these tools and try to create the maximum amount of engagement among the users. And fourth, what we're doing today, share the results, and that's been in the form of these annual webinars. The number one, two, three, and four, those four boxes, those are the categories in which we compared these companies to each other. But today we only have time to focus on what we haven't read there, and it's really the most important thing. Just what do these companies do? These vendors, what are they? How are they supporting tier one, tier two, and tier three needs? But you can see we're trying to figure out, is it student facing? Do they support parents? Do they support staff? We look at the process for enrollment and matching coach or clinician. Do they coordinate and track and report to the school the overall metrics? What's the business model? What do these cost? And what's the profile of the company? What's the diversity? What states are they in, et cetera? All those are things we keep track of. Next slide, please. So as I promised, a little bit of detail on tier one to start. Generally, tier one, you get self-directed content. You get the ability for students or staff or parents to find information. And you're going to see from one of our presenters today, there's quite a bit of strong content out there on the part of these, and in some cases, interactive tools. In some cases, there are webinars and videos that are recorded and available on demand, and that's been very popular. There's parent topical webinars. They're live webinars, but the participants are anonymous to each other, but they can pose questions into the webinar. And then there's staff and whole class presentations. One area that we want to dig into more are the screeners that are coming available. So if any of the listeners here have an interest in that, let us know. That's an area we think is incredibly important coming forward. There is, and I'm not sure where this is, Brenda might comment it later towards the end of but there's a pending, in Illinois anyways, and in other states, mandate for screeners across the school districts. And that's kind of a scary thing, because if all these needs are, that's a great thing, but it's also flip side. If all these needs are identified, then, aren't we supposed to be able to do something with those students? Next slide. This is a very interesting category. It does offer personalized engagement with the student or with the parent, synchronous or asynchronous coach chat, in some cases, actual phone discussions and such. In some vendors, and again, I'm kind of globalizing this across these different vendors. This is a collection of the different things these various vendors can offer. None of them offer everything. Sometimes these are solution-focused therapist or coaching sessions on a particular topic of need, skill building, brief evidence-based curricula. Peer chat forums. This is an interesting one. One of the vendors has a peer chat room that is moderated, and the participants are anonymous to each other, but known to the company, and they screen out anything that's problematic, but they help kids talk to kids. Then there's parent support groups and educator sessions. So that's an example of tier two. We generally think about that as um, not someone necessarily that has a diagnosis. It might be what Brenda would call garden variety anxiety or depression. These are resources to enable them to talk to someone and have some support. Next slide. And of course, tier three is teletherapy generally, Zoom. There's in-session online tools or play therapy resources on screen. This is conducted in some cases with family uh, for younger kids. So it's more of a family therapy or one-on-one with students. There's the ability in some cases to communicate via chat in between sessions, which you can imagine is incredibly valuable because when things happen, they happen. Doesn't necessarily wait for 2 weeks for the next scheduled appointment. So you can see just the incredible value of these resources. Next, oh, in dashboard, in all of these cases, it's very important that the school in some ways can keep track. Now, in most cases, it's anonymous information that the school gets. But in the case of tier three, in some cases, the school is well aware of the students, and that's for some vendors, not others, and it's a choice that you can pick. Go ahead, next slide. Okay, we have three spotlight presentations, and just we put this in here. We wanted you to understand um, we have a tier two to start off, and that's Bob Gold from the Big Hollow School District, and then we're going to go to tier three, and then we're going to go to tier one, and it seems out of order in terms of tiers, but there's a reason for it because directly after um, Principal Jones from Laura Ward STEM School discusses her results at Laura Ward. We're going to get into the overall results for the same tier one, tier two resource at Chicago Public Schools. Next slide. Just to give you, this is this is a slide from the vendor. We've anonymized it again, taking vendor information off. But before Superintendent Gold gets started, we wanted you to see this is the kind of resource that this tier two resource that's being offered. It's text-based mental health support 24/7, smart matching in terms of who your coach is, and self-guided resources. Next slide. And this another look at it. Anytime, no cost to students, FTC compliant, HIPAA, FERPA. So with that, Superintendent Gold, please share with us your thoughts and insights about this.
Excellent. All right, welcome everybody. We first got introduced to this resource. It's the resource we use is called Counselor. About I would say a year and a half ago, and in my experience as a school superintendent, I serve on the Illinois Association of School Administrators Board of Directors, and we provide a similar resource for school superintendents. And I've been involved in that and just getting the data from that as to how much our superintendents utilize that resource. And post-pandemic, the utilization increased significantly, and which I found kind of astounding. And when I ran across this resource for students, I immediately was interested. And we are an elementary district K8, so in talking to counselor, we were able to provide this service. It's a very similar. It's like you mentioned, it's a one-on-one texting. Have access to a counselor anytime, 24/7, unlimited for the students, no cost. We were able to do that for students in grades 6 through 8, and then also for all of our staff. So I was very interested in meeting both of those needs. Based on, post-pandemic changes we've seen in both students and staff, we thought this would be something that we wanted to give a shot. as a result, what we've seen is that it's been very easy to access. The processes that counselor sets up as far as for students to set up accounts, for students to have access, it's very simple process. One piece of data that we've seen that's been very interesting is that they report to us, the council reports to us that about 85% of the students and staff who have accessed the platform do report that they've never accessed mental health support in any other way. So this was their first access. And so I feel like that to us was validating, and that we've made it easy for them to access help to people that outside of having this resource have not accessed help before. So we think that's a pretty valuable piece of evidence for us. This is a resource that has been mentioned, fits into our tier 2 services. Students do seek this on their own, but with some guidance from our social workers so students are getting support from social workers who will be given this tool as something to reach out on their own. But they do have to take initiative to do that. But we do give them some prompting through the tier 2 time. I would say that implementations, issues that we've had would be centered around, I think, getting the message out. We promote it. We promote it as much. I feel like we promote it an appropriate amount, but we do it through student announcements. We do it through newsletters that go home to parents and students. We have posters throughout the school, so we promote it appropriately. Obviously, as when I see the data, I do wish there were more kids that were taking advantage of it. But I think we are at like since implementation, we are at like a 7% engagement among our students and staff. So, which I think from what I hear is a solid number, but of course I know the resources there and I know we have needs. I do wish we could get it out there more. So there's challenges with that, but we feel like we've been fairly successful with it. I was asked about any unanticipated difficulties. I think that just for us, it's just around communication. We have we feel like we get the word out, but then when we do, we still hear from people that they weren't aware of the resource. So that's a struggle for us, is communication. But an issue I anticipated was maybe parents not feeling comfortable with their kids having this access, but that has not been the case. We've promoted it hard to parents, let them know the resource is there. When a student reaches out and seeks the help, an automated email goes to the parent, and they can opt out at that time. But it's an automatic opt-in based on the fact that we have let everybody know that this is available. The kids have this available, but they will not access the service until they will know when their kid accesses the service, but then they can opt out. If they don't opt out, then the kid's in. So it has not been an issue at all. So we've really we've benefited from that. So I would welcome any questions at this time for anybody or Terry, if there's anything else you want me to cover that I missed, please let me know.
And if you do have questions, please feel free to put those in the Q&A now.
Yeah, and I'll get you started with one, Bob. You mentioned 7% engagement. We actually checked. It's almost 8% now.
Okay, good.
But here's the thing. It struck me as you were talking. It's available to the kids for free, unlimited. But from a superintendent standpoint, you have a fixed price. In other words, you don't pay, unlike therapy, right?
Correct.
Or whatnot. It's not a per session that gets charged to the school or the parents or whatever. You have a fixed price, a budgetable amount that you pay per year, right? And it's not, and all that help is available to, 900 people or whatnot. And you know what you're spending. There's no surprise.
Yeah, there's no surprise on our end. It's a fixed amount, and it's, I would say for us, it's probably half the cost of a full-time employee, of an average full-time employee cost. So, yeah, it's a fixed amount and it doesn't change no matter the usage. So that's why, if I have my business hat on, I would love to see more engagement because I know we're paying for it, and I would love, and I know it's not going to cost us any more to have 50% engagement. So I would love to see it, but I think the 8% from what I hear is a very solid number. So
I wanted to bring up something that's unique about this particular vendor, and that is that they have a patented um, protocol and a system for when students indicate that they're suicidal or
yeah,
they're at risk of where, I mean, obviously you chose a tool to provide, for these tier two needs. But sometimes, a young person who's signed up for the service has higher level needs than the service is intended for.
yeah.
And so they've perfected and patented their tool to get that child help. Do you want to speak to that?
I can. I
Mhm.
probably you may know a little more about it than I do. I'm aware of that service. I'm not aware. We are not made aware if it's been utilized for our kids.
Mhm.
But I know it's there, and it was definitely a peace of mind for us
Yeah.
that it wasn't just going to be something that they were going to inform us that a child needed extra help, but it was that they were going to start that process. So
Yeah,
It's
I think it's amazing because, as a school professional, you're really entrusting, other people to serving your students. And sometimes, the folks at the school really wish they could know, who's getting help and all that kind of thing, because they're worried, right? And so to know that tool or that service is baked into the platform is
yeah,
really comforting to me. I'm sorry, Terry, you look like you were going to say something.
well, it's called SOS.
yeah.
And that's this feature. We haven't seen it anywhere else, but it's incredibly important as a backup. Bob, have you gotten feedback on topics or areas of, is there any kind of feedback loop to say these are things kids are worried about at your
Yes.
school?
They do give us that feedback. And off the top of my head, it's a lot of family concerns, bullying, and then suicidal uh, ideations, things like that. So that's primarily what we get. Um,
And
yeah,
so
go ahead.
sorry, but there is a question. Stephanie Morris did ask, can you verify the program you've been using again?
Yeah, it's called counselor, but the counselor is spelled with I think it's COUNSLR. So it's not spelled as counselor would be spelled. Um, and I do want to clarify, and I know this session is for our youth, how we're supporting our youth. And I do want to clarify, because I did get into this with the intent of also providing support for our staff, because I need them to be at their best to serve our youth. So we really, I was, this was able, I was able to get both our youth and our staff access to this, which is really important for me.
Are you getting any feedback from that staff? Um,
Not directly. I think that people that use it probably want to remain anonymous, but we
yeah,
we do see our numbers are pretty strong with staff. Yeah.
excellent.
Yeah.
Okay, Brenda, did you have anything else?
No, thank you so much, Superintendent Gold. That was amazing to hear from you directly about how it's been going.
Thank
Okay.
you, and I appreciate the time.
Thank you, and best of luck, Superintendent Gold, in your, we understand, upcoming retirement.
I got another year, so I'm good.
Oh, okay. Well,
One
that's
more
good for
year.
everyone.
Thank you.
Awesome. Okay, Brenda, I am getting a blank boxes on the
Ooh,
other slide.
I am too. I don't know what happened.
So hit it. Okay,
Oh,
here you
I
go.
see.
It's a
Okay, there we
progressive.
go.
One of those fancy slides. Again, without naming the name, but our next participant here, Dr. Sarah Bates, is going to talk about the implementation of a teletherapy, Tier 3 teletherapy resource. This is your quick flash overview. This is from the vendor. Of course, it's been anonymized unless I missed something, which sometimes happens. But I did just want to point out that thing at the bottom of the elementary family teletherapy, play therapy one-on-one with the therapist. They have online tools for that, which I love. That's the kind of sophistication. But let's turn it over to Dr. Sarah Bates, and let's hear your thoughts on this.
Hi, yes, thank you so much for having me. I really appreciate it. So we were awarded the Stronger Connections grant 2 years ago as a district, and we knew pretty early on that we really wanted to increase access to mental health resources for our students. We are fortunate enough that we have a wealth of relationships with our community providers, but we felt like we were still really falling short with access to mental health care. And so we felt like if we were to explore a partnership with an online teletherapy program, that we would definitely increase some of that access for our students. Going into it, we were really looking for a provider that we could build a relationship with. And so we weren't really just looking for a company as a whole that could provide teletherapy. We were really looking for someone who was going to come in alongside our MTSS model and really work with us. So a company that was ready to really work alongside our clinicians, was comfortable meeting with families, was comfortable meeting with our school administrators. We really wanted to kind of form that partnership. And so we were lucky enough to find a company that was able to do that and provide that for us. We also knew that we wanted to increase access for our parents as well. And so the company that we chose also provides resources for our parents as well. They lead monthly webinars. They have really, really great toolkit resources, and they also provide lessons that our teachers can push out as well. So kind of as time has gone on, they've really evolved in what they are able to offer. And so we're really happy just with that side of it as well. Again, one of the things that we knew was that we really wanted to increase access. And so we wanted to make sure that we were able to provide services completely free of charge. We wanted to make sure that our families were not worried about how they were going to pay for services. And so we're very proud of the fact that we are able to provide free mental health care for all of the students in our district. And that was really a model that we chose out of several models that they offered. As far as how this really fits into our MTSS system, we've really asked our clinicians and our school staff to look at how this can really be layered within their tier 2 and tier 3 services. So again, we do have really strong relationships with our community mental health providers. And so we're always making sure that if a student needs individual therapy, that there is that option to provide that in person to them. And so we've really looked at this kind of as that tier 2.5, tier 3 model for students. We also know that there are some students who are just not able to access therapy during the day, and they need to have an evening or a weekend appointment. And so with this provider, we were able to fill in some of those gaps as well. One of the ways that we have navigated data privacy, it was an option to kind of connect all of our systems and upload all of our student information to this system. We chose not to do that. And so when a parent consents to, yes, a referral can be made for a student, that is when that student's information is uploaded into the system. So we've been able to navigate that a little bit as well. We've also been really happy with the way that they have navigated our students that are at that age of consent. So in Illinois, it's 12 and above, and they've been wonderful to work with for our students that are 12 and above that would like to access services but don't want to include their parents in those services. And again, those have been really great conversations with our clinicians and with their staff as well to really figure out how do we really work in the best way possible for the students. They've also been a part of conversations for kind of expanding and continuing services as well. So the program itself is generally 12 weeks. If a student needs more than 12 weeks of services, they're letting us know like, hey, we'd like to continue with this student and here's why. And then we've been able to kind of authorize those things and look at how do we transition this student either to one of our in-person providers or to our in-school clinicians. So overall, we have been very, very happy with our partnership. I think you're going to look at the engagement numbers later here. And I think right now we have about 120 students that are currently engaging, which I think going into summer is grades. I mean, that means that there are 120 students that would potentially not be able to access mental health care that are currently accessing. That's about where our number has sat all year. I think we've made a little over 350 referrals this year, and referrals can come from our school staff or they can come from parents or students themselves. So anytime that we have an opportunity to really talk about this service, we have that QR code out there because we want to let people know, hey, this is out here for you to access and it is completely free. I do know that one of their hopes in the next year and something that they're currently piloting is an option for parents to receive teletherapy as well if their student is engaged in the service. We're super excited about that and hope that that expands to us out in Illinois as well, because that is definitely something that we would love to offer for our families. Again, we were just really looking for how do we increase access for our students? How do we make sure that our families are aware of the things that are out there? We really looked at it as a way not to duplicate services or replace those relationships that we have with our community mental health providers, but really to work alongside them and kind of complement some of those services that we have currently.
That's tremendous. Thank you, Sarah. Quick question, and Brenda, I know you have some, but th this is the first or second year for this?
We're currently in our second year of implementation.
Okay, so and did you find it took some time to get it started, ramp up? What are you seeing in terms of the acceleration?
Sure. Yep. So one of the things that we go over with them every month is kind of that engagement funnel. So what happens from referral all the way through to first and second appointment. And so they're giving us the numbers for, hey, you've had this many referrals, this many people have filled out the paperwork to continue onboarding, this many have been matched with a clinician, and then this many have actually completed their first session. And so we really are always kind of looking at that pipeline to look at where are those gaps, how can we support in that, and then we're able to reach back out to our school staff to say, hey, can you follow up with this group of students because we submitted the referral, but maybe they haven't been matched yet with a clinician. And sometimes, that can be because of availability or that they're looking for a very specific clinician and it's maybe taking a little while, but we're able to really make sure that we're partnering with the family along each step.
Okay, great.
If any of you all have questions, please put those in the Q&A. Jesse Rodriguez Hammond says, are the students seeing the clinician during school hours?
So they can, for sure. It's definitely not our preferred model with our teletherapy provider. We prefer that they're using it outside of school hours or on the weekend. Certainly for some students that doesn't work because maybe they don't have a private space or internet access at home. So our school teams have been wonderful about finding students places to go so that they can access therapy during the day.
What percent would you say would it be 50-50? Do you have any sense of what the timing,
Yeah, most often it is access outside of the school day. I think that they have availability until 8 p.m. and then they've also got that weekend availability. And so especially with our younger students in elementary, we're really finding that families are using that Saturday morning, Sunday morning time to access family therapy together because at that elementary program, it is important to have the parents involved.
Great.
I was going to ask you, Dr. Bates, you mentioned that students who are over the age of 12 and can consent for themselves to participate, what did you do on the front end in terms of acquainting parents with that process and anticipating that, some parents might have concerns about their student seeking help without their knowledge?
Sure, absolutely. So I think it's a lot of education for our parents in general, but also a lot of education for our clinicians to really think about, even if a student needs to consent for themselves to receive services and they're not comfortable with a parent being notified at that time, maybe we're working towards a relationship or a partnership with the parent so that they can be included in the process because we do know that that is when we're going to get the best outcome.
I'm going to call this question out to both you, Dr. Bates, as well as Superintendent Gold, if you're still with us, Superintendent Gold. What was the lead time between a student needing something, reaching out, and getting support? I'll
Yeah,
start.
for our provider, it currently happens within about a 48-hour window to where they're receiving information from the provider for onboarding, and then they're pretty quickly matched with a clinician. We can pretty much ensure that they are being seen by a provider within about 1 to 2 weeks, which really, in the scope of mental health care, is amazing. And so that means that we really are able to say, hey, go ahead and make this referral because you're going to see someone within 1 to 2 weeks. And I think that that is huge.
It is.
That was something that for me as a clinician, that was super important to me. If we're going to make promises to families to say that you have an opportunity to have access to free mental health care, I want to make sure that you get that access and that you get that quickly. And so that is something that we're always following up with them to make sure, like, hey, are we really seeing people within 1 to 2 weeks? Because if we're making that assurance to our families, we want to make sure that that happens.
Yeah, and that's for a live personalized
A
session,
live
an
person.
hour
Yep.
with a clinician. Are these
Yes.
generally
Yep.
or always clinicians,
Mhm.
coaches? Okay. And I don't think we have Bob still, but
No,
I,
that's
I
correct.
do see another question in the chat here.
okay, go ahead.
It says, I am a mobile crisis response team member. I'm curious how we get notified if a student is making SI comments to the online clinician.
Sure. Yeah. So in those cases, if we have a release of information between the student and our provider, they're generally reaching out to our school clinicians to say, hey, let's work together to have a meeting. Let's really talk about what's going on with the student so that we can support them during the school day. They do have emergency procedures so that if something like that were to happen while the student is actually in session with us at school, that we're able to then respond.
And
Um,
my
you,
understanding relative to Superintendent Gold's lead time with the tier two, it's typically much quicker. You're talking about 24/7 ability to text your coach, which is the resource he has. And usually somebody is getting back to you within 12 hours, if not immediately, depending on the time of day type thing. So,
I
and
just
that's,
want
yeah, go ahead, Brenda.
I'm sorry. I just wanted to mention that the person in the chat is a mobile crisis response team member, Dr. Bates. So I'm thinking this is potentially somebody who's working at, a crisis,
Sure.
in the community. And I'm wondering if a student's in crisis, is there a protocol within the vendor that triggers that, or would they be telling you and then you would be calling the crisis team?
So they do also have their own emergency procedures of what they do if a
Okay.
student expresses suicidal ideation. If it happens during the school day when the student is in session with us, they're kind of doing both things at the same time. So contacting
I
emergency
see.
services while also making sure that we're aware as a school.
Okay, that's great. Yeah, so that person works at SAS, they said.
Yeah.
Yes. One of the things that was my favorite thing about the vendor that you chose was that they seemed very acquainted with the public health model or the MTSS
Yes.
process and wanting to be really woven in to your MTSS process.
Right.
And that was really interesting. At the time that you started with them, I think they had their own universal screener as well.
Mhm.
And now there's another company that's doing the screening. But that's a question that often comes up in Illinois with with our new law that
Yeah.
all schools will be doing universal
Yep.
screening. How does, screening fit with this? Do you all do your own social emotional or mental health
We
screening?
do, yes. So we're currently using the SSIS at our K-8 level. This past year, we started implementation with them to use their universal screener, and then for scheduling reasons, we weren't able to continue. But this coming year, we will be using their screener at our high school because there's a really great connection between the screener and then services automatically for the student. So they can complete the screener, and then depending upon the results of the screener, they're able to opt in to therapy right there from the session. And so that would be done kind of in that 20-minute advisory period that we have at the high school. And so we're hoping again that that would really help to increase access. We also have at our high school, we've done stickers on all of their Chromebooks with the QR code to this service. And so
Wow,
students are able to scan the QR code and they're able to refer right from there.
that's amazing.
There's a question
Doc-
here on what that vendor name is as well.
The vendor's name is Daybreak Health.
Great.
All right, Dr. Bates, thank you so much.
Thank you so much for having me. I really appreciate it.
That was excellent. Thank you.
Thank you.
Okay, next we have a tool that is Tier 1, which is on the left-hand side. That's not all of their Tier 1, but also Tier 2, and this is a parent-focused resource. But you can see on the left this mental health series. These are webinars and videos. This is a little dated. It's a lot deeper than this. So this is probably a year and a half old, but it gives you a sense of the kind of topics that a parent can cover, can research on their own, and get the kind of content, and sign up for a live webinar where they could anonymously ask questions and even participate in a monthly Ask a Therapist program. We're going to consider that also somewhat Tier 1, but it starts to bleed into Tier 2. To the right, you see parent coaching. And this is the one-on-one calls with a coach, 24-hour messaging, and you can see the other supports there. This is a remarkable service that we have worked with CPS and some other schools on. And to represent that, we'll hear from Principal Finley Jones. Go ahead, Principal Jones.
Good afternoon. My name is
Oh,
Shannon Finley Jones, the principal of Lower Ward STEM School, and we had the opportunity to partner to receive this amazing service around the end of Q1. We were actually one of the last schools in CPS to get the opportunity to partner because they had filled their quota and we got the last chance. So for us, we are partnered with through collaboration with Cook County's Cook Center for Human Connection and parentguidance.org. So this program allows Lower Ward STEM, who is a school that's located on the west side of Chicago. We have about 300 students as a population, but we saw a need to provide our parents with social emotional supports. We are affiliated. We actually have an in-house clinic in our school, Erie Health Clinic, that does an amazing job with our school counselors and clinicians with providing resources for our students. So we have an amazing counselor, social worker that's in-house to provide supports for our students, but we also saw as a school that our parents are coming in with and need strategies to support our scholars. And so when they come in and we're trying to find a way to connect them to community resources, which is sometimes limited in our community. And so with this partnership with Parent Guidance, parents are able to receive that coaching and support in the comfort of their own homes, or even when they're driving in their car, and they can click on the links to provide supports. Some of the series that they can log on to is effects of screen time on your children's mental health, building your child's confidence, emotional regulation, sessions on bullying. That scholar may be having issues with school avoidance, grief counseling, which we know that impacts our families a lot, and not knowing having the supports to deal with the aftermath of grief, not only with our students but with our parents as well, and suicide prevention. And so there's this monthly resources that parents can log on. And it's also available to, we even open it up to our school community because we have parents on our staff too. So they serve dual, their parents and their staff members. And so one of the ways that we were able to get this information out to parents, all of the flyers that we receive, we posted it on the doors. It's in our case manager's office, who has a great relationship with parents. So when parents come in for their scholars IEP meetings or just to sit and talk with the team, there's a poster on the board and she explains it, to parents, and also have, a computer available to give them the space to sign up and log on. Our counselor as well. So we have really tried to um, advertise this with our family. So every report card pickup, we have a table set up with the flyers and a computer, open house, and just every opportunity that we can. And also whenever there's, a parent may come up for a parent conference and we see that this parent is a good candidate, that's it's already in our, asking the parent if they signed up to receive that resource. And so I think we've been doing, our goal is to always reach more parents, but I think with this being our first year, and this is our first year with the program, we have seen some benefits from that because parents, are logging in and using the platform. Like I said, and that's definitely for us with our MTSS because again, we have supports in place for our students with their tier one, tier two, and tier three. But our goal as a school community is always to increase our parent engagement. And we increase our parent engagement when we have actual quality resources that parents can benefit from. And this is something that parents can benefit from and word of mouth, because if you have one parent that has logged on and saw the benefits, they would definitely share the resources with parents. So it's a virtual platform. So parents, if you have a cell phone, they can log on. They have a computer. So it's amazing in that way. You don't have to have a lot to use it, and it's user friendly. So that's something that our parents have also found that is user friendly. And the parents that have spoken with my case manager and I, they have definitely benefited from the program. And our goal next year is to increase the percentage that we're adding just to have, double that next year because we know that every there's something on the platform that every parent can benefit from. And so some of the challenges again is for Ward, our school, our population, our demographics have shifted. So making sure that our um, newcomer parents or Spanish speaking parents have the same capabilities to access the information. So we have, making sure that the flyers are in Spanish in their language so that they feel comfortable using the resources as well. And just having individuals in the building who speak their language or speak Spanish that can help them navigate the system as well. And so we have recruited a few of our staff members, our nurse who speaks Spanish. She, even though it's out of her scope of job, she's definitely provided that support to our parents as well. So making it universal that all of our parents can have access to that. And so I think that that's something that my team, because we did have a team that included myself, my case manager, my counselor, and our interventionist was a part of our planning team as well. And so just to increase that. But again, parentguidance.org and then affiliated with the Cook Center for Human Connection is who we have used. And I can say that it's definitely been a benefit for our school population this year.
That's fantastic. Thank you, Principal Finley Jones. That's covering a lot of ground. Quick question. How hard was it for you to promote? Did you get ready to go information from the vendor did you have to make up all this?
No, I didn't have to make up anything. We received a box that had flyers, posters, all of that. So we didn't have to create anything. They even gave us like an email blast, a PDF that we can email to parents as well. So we emailed it to parents. And the flyers, they gave us stickers. So when parents first come in the main door, they see the stickers on the door. Posters are, like I said, the main entrance on the main level, the counselor's office, the case manager, but we receive all of the promotional materials.
And did you feel like the Spanish-speaking population were adequately served either by the content resources and the coaches? Did you find that was well covered?
Definitely the promotional materials because we did receive English and Spanish. It's just as a school, we're finding ways because a lot of our they're newcomers, so they're new to, our neighborhood and our community. So finding a way to make them comfortable to seek those resources and building those relationships. So that's something that we did this year so that we can actually know what their needs are and be able to guide them in the right direction. And so hopefully the students that we had this year will return next year. So we spent a lot of time just building those relationships. And so I think this upcoming school year we'll have be able to communicate with them a little better and they'll be more comfortable to come to us and let us know what support they need.
And I do understand they have webinars, and some of these topical webinars are in Spanish,
Yes.
different days.
Yes.
In fact, it seems like there's one every day on a different
Yes,
topic.
and they give parents like there's like a monthly calendar, so you can look on the calendar and pick and choose the sessions that you feel like you can benefit from.
My favorite thing about the vendor that you're implementing, Principal Jones, is the actual website. Well, I mean, I love the one-on-one parent coaching. That's my favorite thing. But one of the things that's unique about it is this website is just like you can go down a rabbit hole.
Yeah.
I mean, it is so comprehensive. And interestingly, there are like 4 tabs across the top, and 2 of the tabs are available to anybody in the world. They can go. There's just 2 of the tabs that are sort of the behind the paywall, I guess you'd say, for their resources. But the videos they have, on any given topic, they have like a video that's under 3 minutes long and one that's like 40 minutes long. So, depending on how much time or interest a family has in a topic, they could just watch a little 3-minute thing and learn a lot and
Yeah.
decide if they want to go deeper into it. So that's one of the things that I loved about it. And in addition to the Spanish, that website can be translated into, I think, 5 or so more languages by, pushing a button. And so all the print will change, which I think, could be helpful to some of the newcomers that don't happen to speak Spanish. But thank you so much. I don't see any other questions in the chat. Is there anything else you want to share, Principal Jones?
Just that I'm glad that we had the opportunity to partner. I guess I know we kind of got in at the last minute, so I'm glad that we were selected because it definitely has benefited our school population this year, and hopefully we are able to continue the partnership this upcoming school year.
Well, the audience is about to see something pretty remarkable. We have the engagement statistics to share, and Principal Finley Jones has managed to have the highest engagement. It's a tier 1 resource, so it's much less stigmatizing. But she has 120. This is for us, we do this a lot. This is the highest, that lower right-hand side. We should probably go through these in order. Brenda, do you want to do it, or do you want me to do it?
Sure, I'd be happy to. But just to highlight, this is the number that Terry's raving about here. This is the highest implementation we've seen in all of our pilots, Principal Jones, is that you have nearly half of your parents who have engaged with these webinars and resources on the website, which is just phenomenal. So I will start at the top. So we have kind of a summary of these 3 presenters. So Superintendent Gold is in a ex-urban setting with about 1,700 students and has been implementing for a year. And that resource, remember, goes to students and to staff. But they've had about 8% of the students on their pre-K through 8th grade that have engaged. And interestingly, there's, the parent-child part, and then there's the 6th through 8th where they can engage by themselves. And so that's a tier 2 resource. So if you think about that triangle that I told you earlier, that's a good number of people who are feeling they need something more than just the regular universal intervention, what's available to every child in a classroom and so on. And then in DeKalb, Dr. Bates was with us, and DeKalb is an interesting district because it's got some rural and some suburban and so on, but 6,600 students been implementing for 2 years. And this is, again, mostly one-on-one teletherapy with the students, but you heard some of the other special things, the resources for the parents and other things that they've developed to be a part of the whole continuum of the MTSS. And so they have a little under 2% of their students that are currently involved in therapy. So we don't know, they said that they've kept that number pretty steady. So probably these are not the same 120 students that received support last year. And then within,
before you
go
go
ahead.
to the next
Yeah, go
one,
ahead.
I just want to remind the audience, do you remember when principal or
Dr. Bates?
yeah, Dr. Bates brought up the pipeline? Remember she used that word pipeline? And she said she had 350 referred this year. Now, you see that number, she had 120. Well, what happened to all these? Well, some didn't respond to the referral for whatever reason, but she then, about a third of that 350, let me put it differently, about two-thirds of that 350, the parents started the paperwork. Remember, this is one that gets flagged to the parents. Um, One thing to know about this resource is there is a charge to the school, but there's also they bill insurance, right? So unlike any of the others, this is teletherapy, right? So they'll take any insurance, and that's part of the paperwork that the parents need to fill out. So between 350, they lose about a third to the ones that actually start the paperwork. And then when it comes to actually matching, they lose another third. So that 120 is about a third. And I know that's one of their goals is to tighten that up and make sure more of the people that are referred get the parents fill out the paperwork and they can go finish the paperwork and get the student signed in. Okay, just wanted to get that in there.
Yeah, and I just want to mention that this company that they're using have several different business models. One is, as Terry mentioned, where they're billing insurance exclusively. One is where they're billing insurance and they're also supplementing and getting some money from the school. And then the third is where the school pays for the whole service and they don't bill insurance at all. And I think they might be in that third category, Terry, unless you know something that I don't. But I think that, they started with their grant funding and were able to make sure that, families weren't even paying a copay when they launched. So I'm not sure if they've changed that. But it's a nice thing about a company to be able to potentially do a different business model depending on what a school prefers. In CPS, so we are implementing in more schools than just Laura Ward STEM, but we asked Principal Jones to come to speak today because in this urban setting with only 258 kids to have 124 unique users within the parent guidance system is pretty amazing, especially when you consider that they've only been implementing since October. So 8 months, they've really gotten the word out about this and parents have taken to it. And I think it says a lot about the team there at Laura Ward. So the parents are able to do a lot of self-directed kind of exploring within that library of resources. They're able to sign up and go to the webinars that interest them, and then they're able to sign up for one-on-one parent coaching. And so the parent coaching number is at 4%, which is still amazing for 8 months to have 4% of parents to have signed up. This tool is also available to the educators, and that has been a nice strategy for outreach as well.
Now, we keep saying parents, but insert the word caregivers.
Caregivers,
Well,
for
this
sure.
is known to, this company has been very broad in terms of their mission here, and they want caregivers, family members, grandparents. You're all allowed. So and some of these families have a fairly diffuse set of caregivers. So that's an important note.
That is a good point because when a caregiver logs on for coaching and signs up, they don't even have to say who their child is or anything like that. All they are doing is logging up and they're saying, I'm an adult associated with a child at this school. And one child could have 8 adults signed up for coaching to try to get support and how to meet their needs. And we wouldn't even know because they are really inclusive. Whoever is the significant adults in that child's life have access anonymously to the service. So Terry and I have been implementing
See that
digital.
question, Brenda?
Oh,
Okay.
was there a question?
Yeah.
Oh, yeah. It says
ahead.
in schools, what have people used as best practices to get documents from parents? We're having trouble getting those back from students. We're thinking about using a DocuSign because we have about a 65% fall off due to paperwork. And then there's another question that was, what is the vendor name? If we didn't already answer that.
Uh-huh. Yeah, so this one was parent guidance. I think that that question was for the other one, but what are schools using to get so in this case, one of the beauties of it is the parents are signing up themselves, and they're doing it right through the vendor, so there isn't like a form that needs to come back and forth. So in these three, so the first one that Superintendent Gold talked about, an email will go directly to the parents, and then all they have to do is opt out by email if they don't want their child to receive the service. Otherwise, it will just happen because there's an opt-in. Within the second vendor that DeKalb is using, the just like you would with a therapist, a behavioral health therapist in the community, the vendor takes the responsibility to work on getting the paperwork filled out. And that is also digital electronic process of gathering the information, just like probably if you signed up to your electronic health record at your doctor's office. And then, as I mentioned, through parent guidance, it's not needed. That's what these three implementations are doing. And I think just anecdotally, many districts are going to something like DocuSign or Adobe Sign or something like that to get signed actual permission back when it's needed.
So I just one side note to everyone. Obviously, the time is limited today, but and we're trying to cover a lot of ground. If you have questions or you want Brenda and I to jump on the phone with you, go a little bit more in detail, connect you with one of these vendors, hear more. We actually have a program where we do an overview and work with you to match up with. But if there's any specific follow-up that gets into the very significant detail relating to this ecosystem of services, tier one, tier two, tier three, please drop your information in the chat and we'll get that log and get back to you.
So each of these different pilots and implementations have been funded in different ways. And so, for example, with DeKalb, when they were writing their grant, they worked with us to pick the vendor that was the right fit for them. And so in the case of CPS, we have been working with CPS, and they really expressed this concern about parents. So they're like, we're able to help these kids between 8 and 3, but the parents are having such huge needs for themselves and then to support their children. And so that's what led us to choose to get grant funding to provide this tool to CPS. And this was long about the time that the Surgeon General's report came out that talked about the level of stress that parents were being under post pandemic. And there's also a lot of sort of polarization in the country about doing social, emotional, or mental health related things in schools in some communities. And so this was an option that some schools went towards because it was really just putting tools right into the hands of the parents and enabling them to access services anytime and anywhere. And this has been a big deal within CPS because, there was a lot of fear about leaving the home and things like that for families that were whose status was unclear and so on. So this has been a huge support for the CPS schools. So this is a little bit of a busy slide.
Excuse me, Brenda, quick answer to the question that was posted. Yes, these vendors do serve customers in other states than Illinois,
Absolutely.
but in some cases they don't serve all states. In particular, teletherapy, that resource is available, I'm going to say, in maybe 11 states or 12 states. That's the one we heard from DeKalb on. So
And one of the things that makes a difference is if they're using licensed clinicians, those clinicians have to be licensed in the state where they're providing the service and where the client sits. And so, like with the parent coaching, these are bachelor's level coaches that have been trained, and they are being supervised by therapists, but the actual service is being provided by someone who is not like doesn't have to be licensed in a particular state in order to provide this service. So this is something that we've run into, Terry and I, as we've researched different companies, is they may not have a presence in a state and not be necessarily able to easily have a presence in that state if they don't have clinicians that are licensed there. And so some of the vendors would come into a new state if the sort of the project or the district was big enough, if that makes sense.
and
In general,
sorry, my understanding, parent guidance, the one we're talking about here with these pilots. Oops, I'm not supposed to say the name. That they are throughout the country, and then
exactly, because their coaches are able to practice in any state. I was going to say something about different business models, and then I lost my train of thought.
Sorry about that.
But in general, if we're doing coaching or the tier 1 and tier 2, there's that's people are pretty much available everywhere. And if they're doing teletherapy and they're licensed, that it's a little bit more restrictive. So maybe that other thought will come back to me. So this is a little bit of a busy slide, but we love it because it captures essentially all 5 of the pilots. And so you'll see our pattern here, and we've been in a lot of different locations over the years. And when you look at the tier 1 engagement, this is, remember, the universal, people are engaging it on their own. I think of it as tier 1.5 because tier 1 would literally mean everybody gets it, right? But this is tier 1.5 because individuals are opting into and expressing some kind of a need that they're engaging in. So it's roughly around 20%-ish, typically, that we've been able to get engagement for tier 1. The exception would be in our rural implementation, which I'll talk about in a moment. Tier 2, then, this is where there's more engagement and there's really an identified need where the child or the family is saying, like, this, we're having a problem here. This isn't working out without some additional support, right? We've got whatever the tier 1 is, we need something more, but it's not so far as to tier 3 with the teletherapy. And so again, somewhere around 1 or 2% of the populations will engage in that level. And our different implementations are of different lengths and so on. One of the things I wanted to mention is in our distinctive charter school implementation within the Chicago city proper, it was only 5 months long, but one of the things we did in that implementation was everyone who did engage got an email survey about the services. And we had 100% of the people that completed the survey said that this vendor was the resources, all the different resources that were offered were either helpful or very helpful. And that encouraged us to continue, particularly when Chicago Public Schools was interested in a parent direct vendor. That encouraged us to go forward with that. In the Egyptian Public Health Department implementation, we actually feel good about these numbers, and I'll tell you why. It was only a 9-month implementation. It was across 5 whole counties of space, and we started out with 10 school districts. with the vendor being funded and promoted by the health department across this rural area, not directly from within inside the school. And so that was an interesting and different implementation for us. And we ended up having family resource developers in the schools that were placed there by the health department that were able to get parents to engage. That was a big implementation because of the focus on digital access, connectivity, broadband, and all those things, and in community areas of the community that didn't even have complete cell phone coverage. So these are pretty powerful data. So I want to move into
One more
now.
thing on that. We saw a tremendous uptick at the end.
Oh,
So
yes.
go ahead, Brenda.
Yeah, I forgot about that. So I learned this term, the hockey stick graph, which means it's long and low, and it looks like it's not going to take off, and then it shoots way up. And basically, this is word of mouth, right? It takes a while for people, this was in a rural area where there's a lot of stigma around mental health and even engaging with technology. And so word of mouth takes a little time, but then it takes off. And that community is still using that tool, and that has continued on long after Terry and myself have gone. So I want to talk and do just a few slides about, in general, what we've learned across these implementations. One is the team of people that are doing that implementation and outreach is critical. So having a strong leader who is going to be leading the charge, but also having the authority and so on to model and be to direct that this is something that we as a school are really invested in. Having a communications person, somebody whose job it is to make sure that parents get information in the school or in the community is great to have in your implementation team. And then two different groups of people. One is like your social workers, psychologists, the people that are involved in behavioral health in the school, to make sure that this fits in with everything the school's already doing around mental health. And then someone like a parent leader or a multilingual coordinator who's reaching out, and their job is parent engagement. That's the sort of tier one piece where you're not saying, hey, you're struggling with your child, so you you yourself individually could get this support. This is like, hey, this is for everybody. This is tier one. The second big lesson we learned is that gathering data and progress monitoring the implementation is huge. And so with each school, we establish a meeting cadence to review the data and then let that data inform how we go forward. And it's extremely motivating for the school teams to see what's working and to know that all these efforts are paying off, that parents are engaging. The next thing is that we learned that if we just use digital promotional means, like we send emails, we put people on things on social media, if we just use digital tools to try to promote a digital tool, it was abysmal. Because the very same people that are not clicking on our emails are not going to be clicking on our digital tool. So one of the things we learned is that in-person testimonials and warm handoffs are really, really important. So at the tier one, having those parent liaisons actually sign up and use the resources, have parent coaching, and then be able to talk to the other parents about their experience. At tier two, having, even when it's like a disciplinary situation, to have the assistant principal or the dean or whomever say, I've been using this tool. Other parents are finding it really helpful. I bet it would help you with what's going on with your kid. They're refusing to come to school or whatever. And then at tier three, with those behavioral health teams or special education teams, to have actually the social workers and the counselors and the psychologists to really know the tool and have potentially used it themselves, and can say, oh, there's a video on here that you are going to love, right? And to send a link to a parent that's specific to their child's needs and get them signed up and one-on-one. So in summary, what we learned is that the most effective and cost-effective is to use a public health model and have it be, part of this continuum of services where we are promoting and intervening early when these difficulties are developing. That is huge. We also learned that with the digital tools, they provide access just in time, most anytime, anywhere, at low cost and convenient for everyone. The path of least resistance in getting tools and getting help for kids is to put the tools right in the hands of the parents, because then they are actually allies in implementing the help that goes to the student. Successful implementation requires more than a great tool. So any of these companies can be the greatest thing since sliced bread. If nobody uses them, it doesn't matter. And so communities really need to prioritize and fund their team that's implementing, the trusted messenger, that face-to-face person who says this thing works, and then frequent review of the data. So I'm going to stop there. We literally have a couple of minutes if there's one more question, and I'm going to keep up for a moment Terry's and my email addresses. You will have access to this video and our contact information in this PowerPoint on the website for Partnership for Connected Illinois, which we put in your chat earlier. And so that will be available for you. Any questions right now before we sign off?
And it doesn't have to be a question. If anybody is using something or heard of something and you want to shout it out, please do, or email us.
And I would also say, Terry and I, we are kind of wrapping up sort of this 3-year of pilots that we had planned. But we are open to helping schools choose what they want, to working with schools at whatever level to support them in choosing and using these resources to support their students.
Hey,
And their families.
Brenda, can you put that last slide back up? Someone asked to see those.
I sure can.
So there you go. You can take a quick screenshot or jot them down. Thank you for the up to 50 some people that were here at one point. We're down to 37. You stuck it out for 90 minutes. That was fantastic for us. It is with gratitude to our funders and to you folks, the audience and the guest participants that joined us, that we feel like this is an area that is not well known, not well understood. So incredibly valuable. I just want to reiterate something Brenda said. This is a very cost-effective way. Not to mention if you don't have even a costly way, if you're in a rural area, to serve your kids and your parents and your staff, this is very cost-effective. We do have numbers on what the value was, the cost per student or per engaged user and so forth. That's again, there's the information on our emails. You can reach out to us.
I was going to say most of these, it's like for the price of like half of one clinician, somebody can offer like this whole suite of support. So it's amazing. Thank you everybody for being here. Thank you to Upper Midwest Telehealth for supporting us today, and for the Partnership for Connected Illinois and our funders.
Thank you so much, everyone. Like they said, this recording will be available. Yeah, I think that's everything to say, but thank you so much for this presentation. Super informative. I learned a lot, and I think everyone attending today did as well. All right, so everybody have a great rest of your day, and we will see you next time.
And for those of you who have a colleague, again, this is the recording will be posted shortly.